want to go back to get a point of clarity from you.
Okay.
Many women have been told they have estrogen-positive cancers. So two things there. Number one, do they have estrogen-positive cancers that are caused by estrogen, or do they have cancers that are caused by synthetic estrogens from chemicals in the environment? You mentioned chemicals earlier, so BPA, plastics, cosmetics, pesticides, all have endocrine disrupting potential to behave like estrogen. Mold toxins have endocrine disrupting behaviors to act like estrogen. So what is it, in your opinion, that when somebody has this diagnosis of an estrogen-positive cancer, do those women need to fear estrogen, or is there a deeper story?
Great question. That's what women always say. I had an ER-positive breast cancer. Is my tumor fueled by estrogen, so I can never be on estrogen again? And what do we do with breast cancer patients? We give them estrogen blockers. But in actuality, tamoxifen, which is a major estrogen blocker, has been shown to be helpful in triple-negative breast cancer, which has no estrogen receptors, no progesterone receptors, no HER2/neu receptors. And why? We think that tamoxifen actually reduces inflammation, reduces stem cell activity. So there is two lines of debate and theory of what causes cancer. There are those that say it's caused by cancer stem cells, breast cancer stem cells. They don't have receptors for hormones. If you take hormones, your tumor isn't encouraged to grow more. They're caused by cancer stem cells. And in fact, there is a book out that I urge everyone to get called Estrogen Matters by Avram Blooming, who is an oncologist in Southern California. And he was the oncologist who helped guide the way breast cancer patients are treated. In the olden days, if you had breast cancer, we didn't know how to treat it, so women had disfiguring, disabling, huge, almost whole body surgical intervention. So they would have big parts of their torso removed, thinking to try and save their life. Everyone's got good intentions. It's not like people do things really out of meanness or cruelty. But in the olden days, women were treated excessively until Avram Blooming came along and said, hey, we could be much more conservative in care. We could do a lumpectomy and radiation. We can do mix and match. We don't have to take so much of the body away to save a person. And he was able to prove he had to work with the NIH. He had to initiate studies. He had to retrain surgeons and radiologists. He spent a lot of time changing the paradigm of thought. So instead of getting the disabling surgeries, women can now have different options for more conservative care. He was that guy. He worked with a few other labs. It wasn't only him. He's back. He now is saying, we have made a mistake on estrogen. Estrogen is basically driven by cancer stem cells. It's not driven by estrogen or progesterone. The other theory of thought, so two theories of what initiates cancer. One is breast cancer stem cells. Everybody says it's DNA damage that hits it off, but what's causing that DNA damage? One says abnormal breast cancer stem cells are causing that abnormal DNA damage. And the other thought, which gets everyone in a sticky wicket, is that estrogen fuels breast cancer. And it's sitting right next to that DNA. It's got a parking space right next to it. It's causing this. So this is the theory of a lot of doctors and surgeons today. And on my website, drlindseyberkson.com, I put a group of doctors together to debate, does estrogen cause breast cancer or not? And it's for free on my website called Everything Estrogen. If you go to my first page, drlindseyberkson.com, and I'll give you how it's written. You just scroll down the first page. It's right there for you to listen to. So Avram Blooming has been telling doctors the reason the thought that estrogen fuels and drives breast cancer is wrong in the majority of cases. Nothing's 100% in medicine. In the majority of cases, is that it's not, let me backtrack with this because I want to make it simplistic to Vulcan mind meld it. So when they take a tumor out of a woman, they look to see if there are estrogen receptors, progesterone receptors, and HER2/neu receptors, and the percentage of receptors gives you an idea of the condition of that cancer. So they say if you've got 90% estrogen and 90% progesterone, you can't take estrogen and progesterone because it would dock into those receptors. Avram Blooming says, no, all healthy breast cells have estrogen receptors, progesterone receptors, and HER2/neu receptors. That's a healthy breast cell, a ductal cell. It's got those because that's how they speak and have chit-chats with estrogen. Estrogen docks on those receptors, literally parks like a parking space into those receptors and delivers the genetic information to keep breast tissue safe. So Avram Blooming says, actually, if you have ER positive, PR positive, that's because your cancer hasn't overtaken the health of a regular cell, which has these receptors. All breast cells have these receptors. So if you take hormones, you're not fueling something, you actually have archival remnant of a healthy cell, and that's why triple negative is such a more challenging cancer to treat, because it's lost all of its original cell health, and now the cancer has completely taken over that cell, so there's no more receptors. They call it triple negative. No receptor for one hormone, the second hormone, the third, so it's triple negative, and it's a harder cancer to deal with. So there's two different opinions. Breast cancer stem cells are what drive breast cancer, and hormones have nothing to do with it. And hormones drive breast cancer, and you really should avoid them. So what we should do is look at the science. So before the Women's Health Initiative, and up a little bit overlapping with the time when it first was published in July, when it was prematurely stopped in July of 22, there were 26 studies where people wanted to know, can a woman with breast cancer take estrogen and will be safe or not? And most of these studies were run at prestigious institutions. We're here in Houston. One was run at MD Anderson. One was run at the University of Wisconsin. One was run at the University of Georgia. They went from 36 years in length to some of them were a little shorter, but the average was about 10, 15 years. And they would take a woman who just had ER-positive breast cancer and give her some estrogen. And then they would compare this group of women to a group of women with similar tumor size, similar age, similar height and weight. So we call those matched cohorts. And they would track and see women who had ER-positive breast cancer, how did they do with no hormones? And women with ER-positive breast cancer, how did they do with hormones? And in every single study, nobody did worse. And in the majority of studies, women with ER-positive breast cancer had less recurrence, less death if they did have recurrence. There is a complete theme in all the research on this, which is exactly what the reanalysis of the Women's Health Initiative showed. Decreased recurrence if you were on hormones, decreased death if you did get breast cancer. And not one study showed worse, and the women on estrogen had much higher quality of life. They could sleep better. They didn't get brain fog. They didn't gain mid-torso weight. They had more muscle response to workout. They had stronger bones. They didn't have to go on osteoporotic medications. They did a lot better. So the problem is the doctors we have in practice right now were the doctors who were told that hormones drive cancer. Now there still is these two different theories, so not everybody is totally agreeing that they don't, but we have a lot of research run by prestigious institutions if that's what you want. And some we don't have randomized studies with estrogen with breast cancer, but there are papers coming out from people like Hudis and people who've been in the field a long time saying it's cruel and it's a disservice to deny women hormones. We have not seen that estrogen ups the risk of breast cancer in typical women, and we're not even seeing it in breast cancer women. But when we put on Let's Talk Estrogen, a number of the physicians we invited said, well, I now believe that you can give testosterone to breast cancer women, but not estrogen. Estrogen drives breast cancer. So one of them in particular was a surgeon who then became a breast cancer specialist. So I sent her these 26 studies, no response. And that's the deal when you get information that's different than the way you've been thinking, you get this cognitive dissonance of no response. So we work now with a lot of women who have breast cancer, and and every case is individual and a little bit different, but we like to be able to give hormone replacement as well as other things, but we don't do any of it without the transparency and the agreement of the oncologist, because you get into too much litigious snafu and too many problems, and you really want everybody on board. So I spend part of my time with the patients I treat. I don't charge anything for it. I talk to the oncologists. I send them all this information. I send them everything estrogen that's on the first page of my website, and I chat with them and answer their questions. And I'll tell you one patient's history in particular, but it's with ovarian cancer, and I think it's very, very illustrative. So I had this nurse practitioner, wonderful woman. She's in her mid-50s, and she's had 5 cancers. She had ovarian cancer stage 1. They treated it. She got it back the next year, still stage 1. They treated it. She got it back the next year, still stage 1, thank God. Then she got then they put her on immunotherapy, and she developed malignant melanoma, and then the next year she got ovarian cancer back a 4th time. So she came to see me, and I said, let's put you on hormones, because progesterone is very, very anti-hormone, anti-tumor hormone too. Testosterone is extremely breast and immune system protective. So she was in Minnesota near the Mayo Clinic seeing an oncologist at the Mayo Clinic who was kind enough to get on the phone with me. And I said, look, you've got a patient with recurrent cancers. Here's the research I'm talking about. Can we work together, and can we put her on hormones for a few years and see how it goes? And this oncologist was I found that most of the docs I talked to from the Mayo Clinic are really, really cool. And they agreed. And she's now going into her 6th year of no cancer at all since we put her on estrogen, progesterone, testosterone, and oxytocin. I actually wanted to put her on one more hormone that she couldn't get in Minnesota. It's really hard to get, that I've been on for about 20 years. But she is now one of my most avid students. In fact, I came here to lecture in Sugar Land, and she's going to be here now, this nurse practitioner, and that's an extraordinary story. And we have a lot of patients that had breast cancer, went on aromatase inhibitors, another way of blocking estrogen, and now they have such severe neuropathy and tremors, and they have no brain, they can't even walk, they can't even think, they're absolutely in pain, no libido, forget that, no sex, they're dried up everywhere. And thinking of this one woman in particular, she came in and just cried and sobbed because she didn't feel like she could live anymore. So I talked to her oncologist and said, do you mind if we begin this program? This is what we're doing. This is the research. And the oncologist, now sometimes oncologists say flat no, and one time one hung up on me. So I'm not saying they're all amenable, but the majority of them are, especially with patients who say, I can't live like this anymore. It's terrible. And so we put this patient on hormones, and within a few days, her neuropathy started to improve. We did a few other things, and now a year later, she has no neuropathy, no essential tremor, and she hasn't had any recurrence, and she's doing better. But mind you, if she were to have a recurrence, what the statistics have clearly shown is that she has a decreased risk of fatality, of dying from the recurrence if she does get one. And that is so clear-cut in the literature, it's a shame that women miss out.
I want to back up again.
Please do.
That was great. I want to get your opinion on endocrine mimicking chemicals. And because you said there's two theories that are generally widely accepted, right? One is that there's the stem cell creating the cancer. The other is that it's the estrogen. So where do these other chemicals come into play? Because to me, there's plenty of evidence that shows the chemical soup we're swimming in contributes to DNA mutations and the potential for cancer lines to develop. So what are you seeing?
You are so smart, and you ask such great, concise questions. I appreciate that. So I wrote one of the very first books on endocrine disruption. I have 21 books out, and this was, I don't know which number book this was, but it was published in 2000 by McGraw-Hill, and it was called Hormone Deception. And there were 3 books that came out introducing to the public the concept of endocrine disruptors. Up until 2000, really nobody had heard about it. When I sent it in to other publishers through my agent, a lot of people said this is only worthy of a magazine article. Nobody knew what the heck it was. They didn't think it was worthy of a book. So 3 books came out, Our Stolen Future, Hormonal Chaos, and my book, Hormone Deception. And based on that book, I was invited to be a distinguished hormone scholar at an estrogen think tank with the scientists who developed the theory of endocrine disruption. So I've been thigh deep in alligator land of endocrine disruption since the early 1990s when I started. That book took me 6 years to write. There was no information, no articles you could read. There was nothing written on it. I just had to go to scientific symposiums, at least 15 to 20 a year for several years and interview all the scientists. And when I worked at Tulane, I worked with the scientists who discovered the first hormone receptors. And in fact, our last few conferences were called Hormone. So I've been in hormone land for a really long time. And so even though I'm a chiropractor and a scientist and a nutritionist, I've ended up having my career be thigh deep in hormones. And then, of course, I learned the reason I had breast cancer was that my mother had been given the very first model of how we understand endocrine disruptors. What does that mean, endocrine disruptors? It means a chemical that can disrupt your endocrine system is your hormones. So chemicals that could futz with your hormones. And so my mother was given diethylstilbestrol, the acronym is DES, when she was pregnant with me. I didn't learn any of this till I was writing Hormone Deception and discovered I was a victim of the very book I was writing and the phenomena I was writing. While I was writing the book, I got breast cancer, and I'd been eating organically and detoxing and been a yoga teacher, lived in India, and I started getting multiple cancers. The breast cancer wasn't the only cancer I got. So I started writing Hormone Deception, discovered that diethylstilbestrol, that was the first most powerful endocrine disruptor invented in the world. It was 50 times more powerful than our own estrogen, and daughters born to the women given enough of that in the first trimester all got breast cancer, all at the same age, all had endometriosis, adenomyosis, multiple issues, and now even some of the granddaughters are getting ovarian cancer and breast cancer in their teens. And the men born to those women had a higher incidence of earlier onset prostate cancer and other malformations of their penis and so forth. So we knew that about endocrine disruption from 78 million pregnant women being given it from 1938 to 1971, when it was banned as the most cancer-causing substance ever invented. And it was put in feedlots in Chicago. I'm from Chicago. Were lots of feedlots because it makes meat taste really delicious, and a lot of farmers still illegally use it because it makes meat taste so delicious. And it was put in 365 prenatal vitamins because at that time they thought it it was going to make a normal pregnancy even super, and a super pregnancy, and make it better. But apparently, right when they first were pumping it out, they had proof that it caused cancer in rodent models, and they hid it. And so the shit hit the fan many years later so I'm the last living DES offspring my age exposed to that DES in the womb. And the scientists I worked with at Tulane were the people that figured all this out. So I wrote a book on it. Then based on that book, I got invited to be a distinguished scholar. And then I ended up working with all these scientists that it was extraordinary, the interactions that we've all been able to realize. So these scientists said our planet is encased in endocrine disrupting chemicals, and herein lies the problem. Hormones are the most powerful signaling molecules in the body. They rule the north to the south. Endocrine disrupting compounds are now in egg, sperm, placenta, mother's milk. So by the time babies are born, we're looking at endocrine disruptors being a contributing factor to ADHD, to autism, to violent behavior, to cognitive decline, to reduced IQ, things that you would not want to have happen to your child. So you'd want to detox and learn how to reduce your exposure prior to getting pregnant, or even gentle detoxes during pregnancy, because it's so important. So endocrine disruptors are chemicals that can futz with your own hormones, and we can be exposed all throughout our life, but the biggest deal is when you are a forming fetus and a brand new baby. So where do we get these? You stand under a shower filter. There's many in the water because our water treatment services don't remove metabolites of birth control pills or of hormone replacement or of other pharmaceuticals. We also get them in plastics, in even brushing your teeth with a toothbrush with plastic bristles. We have plastic everywhere. I mean, it's washing clothes that are inexpensive. Many new clothes have plastics in them, and then we rinse that out into the wastewater. So microplastics are estrogenic, and they are endocrine disruptors. Metals are very endocrine disrupting, so lead, cadmium, mercury, and the fish is now all contaminated with heavy metals. It used to be a great food, a perfect food, and now it can be an endocrine disrupting food. But through the work of Bruce Blumberg at the University of California in Irvine, he was able to show that exposure to endocrine disruptors is also making us fat and not able to lose weight no matter what we do. And maybe we need a semaglutide because we've got endocrine disruptors. So he came up with the term that some endocrine disruptors act as obesogens, where they actually make your fat cells worse. How? By altering fat stem cells. So he was the first scientist to show, and I've got a podcast interviewing him, but he's a very somber guy. He's a scientist, so it's not a light and easy that one conversation. But he wrote a book called Obesogens, and it's the understanding of how chemicals futz with our stem cells. And the other theory of breast cancer is breast cancer stem cells, and the other one is estrogen, which we don't believe that estrogen. And why would Mother Nature make the hormones that drive humanity and evolution of humanity and birth? Why would she make those he make those hormones to be cancer causing? And if they were, we'd see more cancer when you're younger, not when you're older.
Yeah, because you're making more hormones when you're younger.
Exactly.
Yeah.
And the one other thing is that pregnancy is a time when a woman has so much hormones in her body, more than ever, and pregnancy after the first year is protective against breast cancer. So if hormones were actually causing cancer, then the more kids you had, the more risk you'd have of breast cancer, when it's actually the opposite. It's nuns that have the highest incidence of breast cancer because they never get pregnant, or most of them never. You mean
Right.